Welcome to Tameside and Glossop Integrated Care Organisation Endoscopy Unit. Please follow us on our guided tour which will show you a patient's journey through an endoscopy. On the day of your procedure, please make sure you arrive to allow plenty of time for parking. There is a drop-off zone located outside Hartshead South entrance. There are also signposts for parking. Please enter the hospital via the Hartshead South entrance. The hospital is well signposted for the endoscopy unit. Please follow the signs or ask at the hospital reception. We are located on the first floor. When you arrive at the endoscopy unit, the receptionist will greet you. Please hand your documents over and give your details. You will then be asked to take a seat. A member of the nursing team will then come and collect you and take you through to the admission area. If you have been escorted by anyone, they can now leave and return when you are ready to go home, or wait in reception if they wish. You will be escorted into a private room where your pre-procedure assessment will take place. The nurse will check your medical history and take your blood pressure and pulse. Please bring a list of current medications and allergies with you. You will also be able to discuss any queries that you have about the procedure and discuss sedation options. A specially trained nurse will then go through your consent with you, answer any questions that you have, and check that you are still happy to proceed. You will then be asked to sign your consent form. If your procedure requires you to have an enema beforehand, we will ask you to remain in the private room and change into a gown and dignity pants. A nurse will come and administer the enema and you will be left in privacy to use the ensuite toilet. For all other procedures, you will be escorted to a single-sex waiting area, which includes changing rooms, toilets and chairs. If your procedure requires you to change, you will be given a gown and dignity pants and asked to change in the private changing rooms. You will be provided with a plastic bag to put your contents in if needed. Your personal belongings will remain with you throughout. You will then be asked to take a seat. There is a television in the room, but please bring reading material with you as occasionally unexpected delays can occur. Somebody will keep you informed of any delays. Please also be aware that normally 3 lists run at a time, so it may be that some lists are running ahead of others and patients may experience different wait times. When it is time for your procedure, a member of the nursing team will escort you into the endoscopy room. You will be introduced to the members of the team and asked to confirm your identity. There are a lot of machines and equipment in the room, but don't worry. The team will then run through some safety checks. This is standard practice to maintain your safety. If you have any further questions for the endoscopist, you will then be able to ask. If you are having sedation, a member of the team will place a cannula in your hand and then position you for the procedure you are having. Before you attend, please read the procedure information leaflet either on the Tameside Hospital Endoscopy website or the paper copy you have received. After the procedure, you will be taken to a single-sex recovery area on your trolley. If you have had a gastroscopy and not had sedation, you may be able to go home straight from the endoscopy room. This will be discussed with you on the day of the procedure. Once in the recovery area, the team will continue to monitor you closely and make sure you are comfortable. Once you are fully recovered, your cannula will be removed and you will be able to change back into your own clothes if you are wearing a gown. A nurse will describe your results and any further tests you require and also give you a written report. You will be able to ask any questions and have a friend or family member present also if you wish. You will then be escorted to the discharge lounge where you will be given light refreshments. Whilst you are enjoying your refreshment, please leave some feedback by filling in one of the feedback cards. We aim to keep your endoscopy experience as safe, comfortable and dignified as possible and always welcome feedback so that we can improve our service and patient experience in the future. When you have finished your refreshments, you will be able to go home and will be escorted back to reception. If you have had sedation, an adult will need to collect you and stay with you at home afterwards for 4 hours. Alternatively, you can remain in the department for 4 hours and take a taxi home. Remember, if you have had sedation, you cannot drive or operate machinery for 24 hours after the procedure. Thank you for taking the time to watch this video.